Can you see my screen now?
Yes.
Yes.
All right, perfect. Welcome everyone to this session.
Recording in progress.
One of our orientation sessions. It has been a long time since we provided an orientation for the exams, but actually the changes that are happening really worth it. When you are thinking about European ophthalmology exams, or you're trying to navigate your way through ophthalmology exams, you actually get stuck in a map like that, like a tube map, where there are many stations that you want to navigate, and there are some cross pathways, there are common stations or joint stations between different exams. And if you look carefully to this map, it is actually not an example, it is an actual real map of the ophthalmology exams, of all of the exams with the cross pathways between them. So you can see now how it is interconnected and how it can be confusing. And our purpose in this session is try to navigate through this map so that we can arrive you safely from point A to point B. Before we get started, let me introduce myself. My name is Ahmed Hamdy Oreaba. I'm a consultant ophthalmic surgeon currently practicing in the UK, and I'm a founder and the medical director of iCourses Academy. So if you just sit back, relax, and just think, does this photo look familiar to you? Like, does it ring a bell? How many times you find yourself stuck in a position like that, where your mind is open like a browser tab with many browser tabs open, and you're thinking about different exams, and you are stuck in the middle of nowhere, where you don't know how to proceed, how to navigate, which exams you should choose. And then you start asking in the groups and asking about what exam should I take? Is the ICO better or the FRCS? And if the FRCS or FRCOPHTH? And then you get different answers to your questions, and nobody tells you the real problem is that everyone is different. There is no one solution fits all in this case. So it depends on many variables that we would like to, or we are going to go through in this lecture, so that you would know where you stand, so that you would know where to go. So the aim of this lecture is to give you a bit of orientation about what exam to choose, and then try to compare the different international and European ophthalmology qualifications, and to clarify the steps and eligibility criteria, the exam structure, the fees or other logistics of the exams, and then explain the cross pathways between the exams to know which exam can make you jump to another exam, and finally then to have a strategic choice of the suitable fellowship exam based on your career goals. So not everyone is the same, it depends on your career goals. So here we come to the big question, and the big question is usually, which exam should I take? Which exam is suitable for me, for my personal circumstances? And it is, as I said, it is not one size fits all. In order to precisely answer this question, you need to determine or answer the following questions. What is your career destination? Do you intend to practice locally, or do you intend to translocate to another country? And is this qualification is recognized in this country or not? So for example, you can choose to practice in the UK or in Europe or in the Gulf region or in other parts of the world, and you need to know if this qualification is acceptable there or not. The second question is, what is your career stage? Are you still a junior? Are you still starting your early residency years, or have you done like good progress in your training and you are now mid-senior, or are you a senior person, or are you a consultant with a subspecialty interest? So depending on your current stage, this can give you an idea about what is the next step and what is the exam that will be suitable for you. The third question, it goes without saying that exam logistics can play a major part in the decision-making process. So if the exam is online or face-to-face, this can play a crucial part as it will save you the cost of traveling. Also, what is the available dates for the exams? Is this exam widely available throughout the years, or you need to be a part of a huge waiting list or a backlog of a certain exam? Also, what is the cost of this exam? Because you need to consider this carefully before starting your journey. And finally, there is what I call the strategic trio. The strategic trio is the three things that you need to think carefully before choosing the exam, which is the exemption, the eligibility, and recognition. And what does this strategic trio mean? So let's start by the first one, which is exemption. I think it can be clear that by exemption, we mean that if you take one exam, it can skip another exam from a different pathway. So for example, it means that the other pathway recognizes the exam that you have already taken. And why this is important? Because the circumstances change all the time. One thing that I can truly confirm to you after my journey with these exams for the last 15 years, that the change is inevitable. Change is the only constant fact with this exam. So it will always keep changing, and you need always to have a plan B before planning your journey. And by having a plan B, it means that it could be that one of your exams is recognized by another pathway or by another Royal College, and this will help you to jump to a different pathway when worse things come to the worst. So it will save you time, save you money, save you effort. And the good example for that is if you pass your clinical ICO exam, this will give you an exemption from the FRCS Part 2 of the Royal College of Physicians and Surgeons of Glasgow, so that you can go straight ahead to the FRCS Part 3. So this is a good advantage of the ICO exams to provide you such an exemption. However, this should not confuse you with the eligibility. And by eligibility, we mean that it is the other criteria that are set by the organizing body of this exam so that you can be eligible to sit for this exam. For example, in the previous example, we said that ICO clinical exam can make you eligible, can make you exempt from FRCS Part 2. But does this automatically mean that you are eligible for FRCS Part 3? The answer is no, because there are other criteria for eligibility, which is the experience. So while the qualification can permits you to enter the next level, but in order the actual exam requirements are still there. If there is any requirements of experience, you should always take this into consideration. And why this is important to think early in the career, because this will help you to determine what fellowship exam is suitable to you based on your experience level, based on at what stage you are in your career. All right. And the third part of the trio is recognition. How widely is your certificate recognized, or this certificate is recognized all over the world? Is it recognized in certain parts of the world? Because the qualification sometimes can be respected globally or locally, but it does not make you progress further. It does not give you an advantage to taking another exam or apply for certain jobs. So you need to understand what is the value, how widely is this fellowship is recognized. And because by the end of the day, you'll find that the exams can be classified into two big categories. The first one, which will give you a license to practice in certain countries, and the others do not give you this license. So they are only good for recognition, good for your CV, good for your personal branding or career branding, local promotion, but not to progress further or translocate to another country. All right, so far so good. Is everything clear so far? Okay, so we can make the questions till the end. Hashim, can you please keep track record of the questions so that we can answer them at the end? Now we are going to progress with or go through the fellowship exams one by one. We will go through the fellowship exams one by one so that we would understand what is the structure, what is the format of this exam, what is the logistics of this exams, why should I take this exam, why should I not take this exam, and finally, what kind of exemptions this exam provide me. Let's start first by the most popular, which is the International Council of Ophthalmology exams, or the ICO exams. So it is provided by an international body called the ICO, or the International Council of Ophthalmology. It is highly recognizable worldwide. It started by the Visual Sciences exam, which does not require experience, and the Optics, Refraction and Instrument exam. Usually you may take one exam only, or most people would take both exams together in the same diet, but you don't. These exams remain independent, so passing one or failing one exam does not automatically fail the other. You still can pass one or fail one if you take both on the same setting. And this is a very good advantage of the ICO exams, that it can break down can break down the optics and visual sciences separately together. And the third, once you pass them, then you progress to the next stage, which is a clinical ophthalmology exam. And when you pass those exams, they are called the standard ICO exams. Then you progress to the next level, which is the advanced ophthalmology exam. And once you clear the advanced ophthalmology exam, you are not entitled.
Dr. Ahmed?
Yeah.
I think the screen is a little bit paused.
Screen is what?
The screen showing the strategic TRIO. Is it the same for you or ICO screen?
I'm in the ICO screen.
Yeah, for us it's in the strategic TRIO.
Yeah, I've got the same problem. I still see the strategic trio.
All right, let me try to. I think could be some connection problem. Let me check.
It's okay.
All right. So again, we were talking about the pathway or the format of the ICO exam. So we said that it starts by visual sciences exam, and then optics and refraction and instrument exam. Then after passing it, you go through the clinical ophthalmology exam, then advanced ophthalmology exam, and you are not entitled the post-nominal FICO or fellow of the International Council of Ophthalmology until you pass a local face-to-face exam. So this is the pathway of the ICO exams. Okay. Let's see about the, then after that, if you wish to proceed to a subspecialty exam, then you would need around 1 year of experience in the subspecialty. So what is the logistics dashboard? Like, what is the format of these exams? So you have a visual sciences exam, it's 120 questions, multiple choice in 3 hours. Optics, which is 60 questions in 1.5 hours. Clinical ophthalmology, which is 200 questions in 4 hours, quite long exam. And advanced ophthalmology, which is 115 questions, which are EMQs and multiple choice, so extended matches questions and multiple choice questions in 3 hours. The venue, this test unfortunately cannot be done online, so it is done at local ICO test centers. And the next available dates in 2026 will be on the 19th of October. And the fees here can be quite vague, as there is no single fees for all the candidates. It depends on which country you are from. So they change the fees depending on the status of the country, if it is a developing country or a developed country. But to give you a rough estimate, like some indicative fees, these are the indicative fees of the different exams in Swiss franc. So whether you are taking the visual sciences only, optics only, or visual and optics together, clinical or advanced. So this is very important to know before you plan your journey what will be the logistics of the exam. Let's come now to the pros and cons. What makes me think of ICO exams and what me think against ICO exams? For the advantages, that it is internationally accessible. So local test centers are worldwide available. I believe that it's almost available in every country. So some countries can really have lack of resources, lack of access to exam centers, but for the ICO, it is well recognized, widely available throughout the world. The another advantage is that there is unofficial recall available. So over maybe the last 15 years, there are many recall questions are available, which can help you to prepare for your exam. It gives you an idea about how the exam look like and what to expect. Recently, the questions banks have changed since 2020, and so from 2020, I believe, to maybe 2022, 2023, the exams have become really difficult. And then after that, with more repetitions of the questions become more of back to normal again. Okay. And one of the major advantages of the ICO exams that it is recognized by the Royal College of Physicians and Surgeons in Glasgow, as it will provide exemption from Part 1 and Part 2. And this is a crucial advantage, as for the ICO, it does not require years of experience, while in Glasgow, it will require a significant amount of years of experience. So this is a shortcut to get access to the FRCS Glasgow Part 3 while you are still building up your experience, as we are going to discuss right now. Also, another advantage of the ICO exams is that it provides you a certain privilege when applying for what's called ICO fellowships. And ICO fellowships are some sort of training programs are designed for ophthalmologists from developing countries, young ophthalmologists, younger than 40 years old, so that they can have access to high quality training in the developed countries. And this can be for certain time, like for scholarships ranging from 3 months to 1 year. And provided that the ophthalmologist will return back to their home country so that they can transfer the knowledge they gained to their home country. So this is a very important privilege for young ophthalmologists, especially from developing countries, who wish to gain further expertise in certain subspecialty or even in general ophthalmology. But you need to be aware that not all the centers would provide hands-on training. So sometimes it can be some centers would provide observerships, and the others would provide like a clinical attachment or hands-on experience. Like I can remember, like back in the day when I was back home in Egypt, I was organized. My hospital was an ICO host, so I used to receive CVs from applicants all over the world that wanted to train in my center, and then I used to check their CVs, check their eligibility, and check letters from their department, whether if they are recommended them, and then organize their training in my center and check their training needs and follow up them, and then we provide reports to the ICO. So I've been through all this process, and I can tell you that it is a very good program for those who don't have access to good training. And then there is also an option of an ICO subspecialty exams. So if you want to be recognized for certain subspecialty, like if you are becoming an expert in vitreoretinal surgery or glaucoma or strabismus, and you wanted to brand your name as the expert in this field, so you might think of doing the ICO subspecialty exams, provided that you have an experience of 1 year at least in the subspecialty. So is everything good about the ICO? Does it have any problems? Yes, it has some problems, or some, I would say, challenges. I think one of the main challenges of the ICO that it is purely theoretical. As you might expect, it does not make any sense that they will provide test centers throughout like more than 150 countries throughout the world and provide examiners to test you in the practical ophthalmology or oral ophthalmology. So at the end of the day, it has to be theoretical. And this means that it is just a paper-based exam. And as they didn't test your clinical skills, they didn't test your clinical judgment by oral exam, then they are unlikely to provide you a license to practice. So ICO exams do not give you any license to practice in any country, as far as I know. However, recognition can vary by country, so maybe there are some countries maybe in the developing world that recognize ICO exams for practice, maybe. Also, when we compare the ICO to the next one, you will find that the ICO still require a face-to-face exam in order to have this title, the Fellow of International Council of Ophthalmology. So it does not. So it is a purely theoretical in terms of what the exam can offer you, but in order to attain the title, you will still need a local exam in your country, like a board exam, or some countries a master degree, in order to have the title FICO. So you will gain the license in your country by your local exam, not with the title FICO, but with your already local exam. So as you can understand, it just provides you some recognition, a title, but the license you have already gained by your local exam. And one of the main questions I have always been asked, like, I have done the ICO exams, does it provide me a shortcut to the FRCOPHTH? The answer is no. Unfortunately, as we will come to the FRCOPHTH now, the FRCOPHTH does not accept any alternative qualifications. So it has to be FRCOPHTH. If you did some parts of the ICO exams, you wanted to change it to the FRCOPHTH, you will still need to start the FRCOPHTH from scratch. Now, speaking about the exemptions, if you did the ICO exams, what will be the next step? If you did the Visual Sciences and Optics exam, it will exempt you from the FRCS Glasgow Part 1. So did the Visual Sciences and Optics, then proceed to the FRCS Part 2 of Royal College of Physicians and Surgeons of Glasgow. Also, the Visual Sciences and Optics will exempt you from the FIOF, or the Fellowship of International Ophthalmology Foundation. So we will come to this in the next slide. It is a parallel pathway to the ICO exams. It's a newer pathway. And if you have done the ICO first part, it can exempt you from the FIOF first part as well. If you did the clinical ICO exam, it exempts you from the FRCS Glasgow Part 2. So you can proceed straight ahead to FRCS Part 3, but again, be aware of the experience limit. You will still need the experience requirement of the FRCS Glasgow. Here can be the confusing part. There are some parts of the ICO exam that used to be exempting from the historical part of the ICO Royal College of Surgeons of Edinburgh collaboration. So back in the day, there were a collaboration between the ICO and the Royal College of Surgeons of Edinburgh, so that the ICO exams can exempt you from the Part 1 and Part 2 of the Royal College of Surgeons of Edinburgh exams. However, this collaboration has ended. This collaboration was terminated. And then this collaboration is no longer available. So if you are still a fresh ophthalmologist or haven't started your ICO exams before 2021, this is not for you. This eligibility criteria can be quite complex depending on which year, which exam. You will find in my YouTube channel some more illustrative videos about this collaboration, but it is beyond the scope of this lecture, so you can go back to the YouTube channel and find more about that if you have finished some or all parts of the ICO exams before 2021. However, the Royal College of Surgeons of Edinburgh still honor the Advanced 180 ICO exam as exempting from the written part of the FRCS Edinburgh. This is still valid. So historically, if you have already cleared the Advanced 180 exam, which was maybe like 5 years ago, it is no longer available since 2021, then you will be eligible to do the oral part of the FRCS Edinburgh straight ahead without going through the written part. So these are all the exemptions that ICO exams can offer you. All right. Okay, so I hope that this is clear. So this is in a nutshell what the ICO exams can offer you. Let's now move to the next fellowship exam, which is a newer pathway. It's a more modern pathway called Ophthalmology Foundation, or Fellowship of International Ophthalmology Foundation. So this has been created based in the USA, in San Francisco, to parallel the ICO pathway. So you will find a lot of similarity between both pathways, starting first by the visual sciences exam with no experience required, then optics and refraction and instruments exam, and again you can take only one exam or you can register both exams in the same sitting, and every exam is independent from the other, so you can pass one and not pass the other, and still the passing of one exam can be credited to you. And after passing these exams, you will become eligible to the clinical ophthalmology exam. And this is the crucial part or crucial difference between the FIOF and the FICO exam, that there is no advanced exams here. Once you pass the clinical ophthalmology, you are entitled the post-nominal Fellow of International Ophthalmology Foundation. So this is a good advantage. And also it can provide you subspecialty exams, which you usually would require around 1.5 years experience in the subspecialty. Okay, so this is the mapping of this new pathway. So what is the logistics dashboard? What is the format of this exam? You will find it is almost identical to the ICO exams. So visual sciences can be 120 questions in 3 hours. Optics, 60 questions in 1.5 hours. Clinical ophthalmology is be less demanding than the clinical ICO. It's only 160 questions in 4 hours, rather than 200 questions in the clinical ICO. And the venue, it is done online, which is giving you some convenience, but not online at your home, like for like FRCS Glasgow or FRCOPHTH London, but it is online at the local test center. So they will give you what test center to be doing this exam or where to do this exam, but you will do online rather than paper-based as in the ICO. Next date will be in September this year, and the fees will be quite cheaper than the ICO, cheaper than the other exams, and these exams are mainly developed for the developing countries. So they would give a World Banks Index tiered pricing, will change the price depending on the economy of the country you are from. But to give you an indicative fees for developing countries, it would be as low as $150 for visual sciences. Optics can be $100, clinical $250. And not only that, but they can also offer installments plans or payment plans if you are struggling to pay these fees. For the developed countries, it can be as high as almost like maybe 3 times higher. But you need always to check with the organizing committee about the actual fees of your exam in your country. So what are the pros and cons of this exam? The pros is that it is modern exam, and by modern I'm trying to give you an idea about the difference between this exam, as I'm trying to always draw a parallelism between it and the ICO. So comparing it to the ICO, I would classify ICO as historical. Some questions can be really confusing. I think we have been all there. We've been all trying to decipher the ICO confusing questions, the stems, the confusing answers, sometimes questions with 2 correct answers, and then we see in the questions feedback or in the answer sheet that some questions have been omitted or deleted or cancelled from the exam because the structure of the question itself is quite confusing. In contrast, the FIOF exams can be quite modern, like less confusing. They are built on the curriculum of the basic sciences curriculum of the or the basic sciences and the clinical sciences curriculum of the American Academy of Ophthalmology. Remember, I told you this is based mainly in San Francisco in the USA. So the exams can be quite less easier and less confusing than the ICO. Also, as we mentioned, there is low cost fees, installment plans if you struggling with the fees. No experience is required, so these exams are mainly done for the juniors. So this is for the entry level in ophthalmology, where if you wanted to start something, usually most people would start with ICO and now the Ophthalmology Foundation exams. Comparing to the ICO, there is no advanced exams, so this will put something out of your shoulder that you don't need to go through a lot of exams in order to gain the title. And also there is fellowships. So this is a collaboration between the Ophthalmology Foundation and the International Ophthalmology Foundation Fellowship Program. I think it has some sort of connection to Europe, but I'm not quite sure. It offers the same like the ICO fellowships. It offers you a subspecialty training for 3 months or 1 year to young ophthalmologists less than 40 years old from developing countries, so that they can train and go back to their home countries. And as we speak for now, the exams of the Ophthalmology Foundations give you extra points. As with the ICO, it can give you extra privilege, but they are not a must. They are not a prerequisite. However, changing from July 2027, the Ophthalmology Foundation exams would be a prerequisite before applying for the fellowships. So bear in mind that if you want to apply for these fellowships, then it's ideal that you start applying before the July 2027, as after this date you will be obliged to apply for the exams and pass the exams. But the question is, do you have to go through all these exams if you have cleared some of other exams? Here is the answer. The good news is that there are good exemptions from this exam. Or before we speak about the exemptions, we speak about the what are the challenges or the drawbacks of this exam. Similar to the ICO, it is still a purely theoretical exam. No practical component, so it does not give you a license to practice. And the main challenge here, comparing to the ICO, that it is not as widely recognized as the ICO. It is still in the early recognition phase. It is still being introduced to many countries. I believe that at some point it will be recognized as the ICO, but we are still not there yet. So newer pathway recognition is variable. So you need to think carefully about that. And as we speak for now, it is not recognized by any Royal College. So while the ICO is recognized by the Royal College of Surgeons of Glasgow, the FIOF is still not recognized up to date. Okay. So what are the exemptions? Well, the visual sciences and optics and the clinical do not exempt you from any other exams. There are other exams that exempt you from the visual sciences and optics of this FIOF exams, like the ICO, the FRCS Glasgow, and if you have the old FRCS Edinburgh, you can still proceed to the clinical FIOF exams. However, these exams on their own, they don't exempt you from any other qualification. As we said, they are still not recognized by any Royal College. So be quite aware that if these exams are going to be just more of a title, more of a recognition, but it's more likely it would be a dead end for now, not going to progress you further to any other fellowship or any other Royal College fellowship exams. Okay, so this is an overview of the Fellowship of International Ophthalmology Foundation. I hope that's clear. Now, from now on, we are going to speak about these Royal College exams, which are giving you the advantage of having a license to practice in some countries, and also we will start to speak about a practical component of the exams rather than a purely theoretical one. So starting by the FRCS Glasgow, the pathway starts by the part 1, or a basic sciences and optics, and this one would require a 2 years post qualification, so 1 year like an internship and another year in ophthalmology in order to be eligible. Then after passing part 1, you become eligible for part 2, clinical ophthalmology exam, which requires 6 years post qualification. You have already done 2 years of them after becoming eligible for part 1, but you need to make sure that your experience is 4.5 years in clinical ophthalmology before becoming eligible to part 2 exam. After passing part 2 exam, you become eligible for part 3, which is Viva and OSCE. So by Viva we mean that it is an oral exam, and by OSCE we mean it's a practical exam. So you need a pass in part 1 and part 2 and experience, which you have already cleared already, or you have already satisfied if you passed part 2. But if you are not, and you have applied for part 3 by an exempting pathway like the ICO exams, you need to satisfy the experience criteria here in part 3. After passing the 3 parts, you're becoming eligible for the FRCS, or the Fellowship of Royal College of Surgeons of Glasgow. Okay, so what is the logistics? The format: part 1 will be 160 questions in 2 hours. Can be quite challenging to do 160 questions in this short time. Part 2, 180 questions, clinical ophthalmology, in 2.5 hours. And to be honest, I'm not sure why they haven't changed that. Historically, there was an exam called problem solving, and we used it to do both exams in the same day. So I have done the problem solving exam in the past, and the they did both in the same day, so that they don't want the exam to be very, very lengthy. So they allocated only 2.5 hours to 180 to the MCQ part, so that you can have more time to do the problem solving. But now they canceled the problem solving, or just discontinued the problem solving, but still the part 2 exam is quite challenging in time. Then in part 3, there will be oral exam, which is 3 stations. Every station is 20 minutes, and a practical exam, which is 4 stations. Every station is 12 minutes. Okay. So what is the venue? Part 1 and 2 have the advantage of being online exams, so that you can take them at the comfort of your home. Part 3 is a face-to-face exam at international centers. It used to be an online exam during the era of COVID, but now it is back to face-to-face nature. So next dates for part 1 and 2, they are in mid-September, and part 3, they are available in Delhi, Amman, Mumbai, and Cairo. Fees for part 1 can be of £470, part 2 £700, part 3 can range from 1,850 to 2,183. It depends on which country you are doing the exam in. Roughly that you will find that almost the exam would cost you around £3,000. All right, so what are the pros and cons? Why should I consider the FRCS Glasgow? It's a prestigious UK fellowship exam, so one of the most recognized UK fellowship exam, and it gives you the advantage of GMC registration. So you can get a license to practice in the UK and apply to jobs in the UK, as well as other countries, maybe in the Gulf region as well. They can give you, can be recognized for practice in these countries. So it has a very wide recognition, and part 1 and part 2 can be done online. Back in the day, also it was locally in test centers. I did it in local test centers, both part 1 and part 2. Now, after COVID, everything has changed, so it's now becoming online in part 1 and part 2. Okay, and available past experience. This is a very great advantage, that you will find massive exam experience from previous candidates all over the world, like dating almost 15 to 20 years back. So you have an idea about what the examiners use to ask, and you will be quite surprised to see that the questions can be repetitive. They keep repeating exam and after exam, and this exam experience can be very, very helpful during your preparation. This advantage is not available as such in other Royal College Fellowship exams, and they are crucial for success. And the other advantage of the FRCS Glasgow, like a few years back, almost like 4 or 5 years, they started to offer the MRCS after part 2. So MRCS means a membership of the Royal College of Surgeons of Glasgow, and after passing part 2, you have this membership. However, because it is offered after a theoretical part, the part 2, it does not offer you a GMC registration. So it is just a title. It is just for your CV, for your local promotion, but not for practice outside your country or in the UK. So what are the challenges? I think it is very obvious that the main challenge here will be the experience. There are some brilliant ophthalmologists out there. They don't like follow the regular routine or regular training schedule. They are ahead of their schedule, and they want to get ahead with their exams as well, and then they are stuck with the experience eligibility, as they would need like 6 years after graduation in order to do all the exams. So this can be quite good for experienced ophthalmologists, like who have been in practice for more than 5 or 6 years, so then they can do all the exams at once or all the exams quickly, successively. But for younger ophthalmologists, they would need to think carefully and to plan their journey, as they would need to wait some time. And this can be quite frustrating, as you just imagine that you did your part 1 after 1 year, and you want to clear the part 2, but you still need to wait another 4 years to be eligible for part 2. So you do your ICO exams, the clinical ophthalmology exam, and then again you find yourself waiting for another 3 years, and after 3 years you forgot, you need to revise again. So you need to think carefully about what are your options, and depending on your current level of experience. Also, there is one of the challenges is a drawback. So just to think of that, there is a huge number of ophthalmologists applying for part 1, part 2 is online, so there is no restriction on the number, and then all of them want to secure a place for the FRCS part 3, as it is an oral and clinical exam, so it has a limited capacity, and now not all of them can secure a place. So we have witnessed that there is a lot of backlog in part 3, but during COVID time and after the COVID, the backlog was really significant, but they expanded the test centers and now they are clearing this backlog. So it is not as bad as it was in the past. The third disadvantage, that it does not give you an advantage in the UK system. So if you want to apply for training, or you want to apply for Caesar pathway, or what is now becoming portfolio pathway, FRCS Glasgow does not add a good value to your application. You will still need to have the FRCOPHTH exam. So it is not for you if you are thinking to settle down in the UK in the long term, or becoming a substantive consultant in the UK in the long term. Again, back in the days when I did this exam, it was the only route available to get GMC registration and apply for jobs in the UK, because believe it or not, at that time, maybe like 10 years ago, FRCOPHTH was not recognized for GMC registration for international doctors. So as someone who trained outside the UK, and I did and completed the FRCOPHTH exams, it does not give me the advantage of practicing in the UK. But now this has changed over maybe 5 or 6 years ago, and now FRCOPHTH can give you license to practice in the UK. So rather than doing FRCS Glasgow, then going to the UK, like what I did, then did the FRCOPHTH exams all over again, then it is better to start the FRCOPHTH if UK is your destination. And now let's come to the crucial, I can't stress enough on that, the crucial disadvantage of the FRCS Glasgow, which sets it apart from the other exams, which is a general medicine and emergency medicine part. So in part 1, many ophthalmologists started to, or have been complaining about the difficulty of part 1 over the last few years. They mentioned significant number of general physiology questions, like you are asked about the endocrine, the nutrition, the blood, hematology, cardiology, physiology. It is becoming more of USMLE type 1 questions and becoming really, really challenging. And after you pass part 1, you go to the part 2, you find again more clinical emergency medicine questions becoming increasing in number, emergency medicine scenarios, emergency medicine questions. And then after passing that, you go to the part 3 and you will find a dedicated station for asking you to emergency medicine. So it is a part of the FRCS Glasgow philosophy that they think that you cannot be a safe ophthalmologist without being a safe doctor. like knowing the emergencies and how to deal with them. So this is a part of their philosophy. And let me share you this funny video that can outline the struggle of the ophthalmologist with the FRCS Glasgow exam, as if like when you see an ophthalmology case, you are becoming happy, then emergency medicine, you get frustrated. So, so this happens with the FRCS Glasgow. So don't forget that this is a major drawback of this exam. It does not mean that it can't be passed or you can't overcome this obstacle. You can, of course, anything can be achievable, but you need to put this in mind while you are considering your options. So let's speak about the exemptions. What can the FRCS Glasgow exempt you from? Well, if you have part 1, if you passed part 1 FRCS Glasgow, it can exempt you from the Ophthalmology Foundation Visual Sciences and Optics exam. We've already mentioned that. So you can go straight ahead to the clinical ophthalmology exam by the FIOF. So now you might think, okay, would it exempt me from the ICO, Visual Sciences and Optics? The answer is no. So it does not work that way. So the official ICO Glasgow collaboration is mainly structured in the opposite direction. Like if you pass your ICO exams, it exempts you from the corresponding parts of the FRCS Glasgow exams, but not the other way around. You got it? So this is the only exemption that FRCS Glasgow Part 1 can offer you. And this, as we come to the end of the lecture, we will see how you need to weight all these criteria and advantages and disadvantages of every exam while you are taking your decision which exam to go through. So I hope that this is clear regarding the FRCS Glasgow. Now let's move to the FRCS Edinburgh. So FRCS Edinburgh is a qualification offered by the Royal College of Surgeons of Edinburgh. And this pathway has been discontinued for quite good few years since 2021. As you remember, I told you that there was a collaboration between the ICO and the Royal College of Surgeons of Edinburgh. This collaboration discontinued, and since that time, the only part that has been offered for FRCS Edinburgh was part 3, only the third part. So in this third part, you start by a written exam, and this written exam needs you to have 4 years of clinical experience, and you are already eligible for MRCS Edinburgh. And by eligibility, it can be either through the old style exams, like for example me, I did part 1 FRCS Edinburgh, part 2 the old style, when the second part was an oral and OSCE exam. So it was like a full oral and OSCE exam with a refraction test, and then after passing it, I have had the MRCS Edinburgh. So this is I have MRCS Edinburgh through this route, or the new style during the collaboration with the ICO, where you have obtained MRCS Edinburgh through the collaboration between the ICO and the Edinburgh before 2021. So either this or that, you become eligible to MRCS, then only then you become eligible to part 3 exam. And after passing part 3 exam, you become eligible to part 3 oral exam. However, as we mentioned, there is the advanced 180. So ICO advanced 180, if you have passed this exam, it can exempt you from the written exam, and you become eligible straight ahead to the oral exam. And after that, you become certified with the FRCS Edinburgh. So as you can see, it is only oral exam. There is no OSCE so far. So this is the pathway of the FRCS Edinburgh as we speak now. And here is the news. Big news, like after 4 or 5 years of discontinuity of this exams, now the exam is going to be reinstated again as a normal fellowship exam. So just a few weeks ago, the Royal College of Surgeons of Edinburgh has announced that it will restart the old or their new style exam. So starting from 2027, there will be a new structure to the Royal College of Surgeons of Edinburgh exams, starting by part 1, part 2, and part 3. So as we speak now, we only know that part 1 will be a new MCQ paper, obviously in the basic sciences. Part 2 will be a single best answer in clinical sciences. And then part 3 will be a Viva and OSCE exam. This is all what we know for now, and more details will be announced in early 2027. But this is great news for those who are thinking about the FRCS Edinburgh. As I said, for the last 4 or 5 years, there were no route to start the FRCS Edinburgh from the start. But now, new pathway is looming on the horizon to start from the next year. So for now, what is the logistics of the currently available exams? So the written exam is 100 single best answer of 4 hours. However, there is no advertised dates for 2026. The oral exam is 8 stations, each one is 15 minutes. And the venue of the exam, of the oral exam, the last date will be face-to-face in Edinburgh. So the oral exam will be on the 16th and 17th of October 2026. Please, here is like an important announcement. This is going to be the last exam. This is the final exam of the current pathway of the FRCS Edinburgh. After this exam, we don't know what kind of eligibility, what kind of exams that you need to undertake in order to enroll in the FRCS Edinburgh again. But probably you will need to do a new oral and Viva and OSCE exam if you are eligible for this oral exam already. So this is your last chance to get access or to apply for this exam and take the oral and get FRCS Edinburgh with the old pathway before starting the new pathway in 2027. So this is one of the major announcements I wanted to inform you about in this lecture. The fees of this last date will be £1,395. So what is the pros and cons of the FRCS Edinburgh? It is a very prestigious UK fellowship. It offers you a GMC registration. You can apply for jobs in the UK after gaining this title. It has a wide recognition. And one of the main advantages over the last 3 or 4 years after discontinuation of the collaboration between ICO and Edinburgh, that the last date is an oral exam only. So it goes without saying that the most difficult part of the third part of an exam would be the practical. This is when your clinical skills, your clinical judgment come to test, and this is where most people would find the challenges. But in the old style, it was an oral exam only, so your clinical skills were not tested in the old style. This is going to change next year. So what are the challenges? As you can imagine, the pathway is actively changing. Every few years, there is a new, different style, different exams. As I said, my old exams were, second part were oral and clinical, then replaced by the ICO exams. Then now they are replacing it with a theoretical MCQ paper. So as I always say, change is the only constant fact. And if I can tell you like one a pearl of wisdom here is that it is now or never. You need to get started, as once you try to think and try to get first steps, you will find that things are evolving rapidly. So all the exemption may vanish in 2027. So I remember from the old style that there were some sort of exemptions from the first part of Edinburgh, but like if you have FRCOPHTH London, but who knows? We never know. We don't know now what kind of exemptions they would offer, what is going to be the exam style. So still we don't know. No UK training, Caesar portfolio pathway entry. As we agreed, if you are into the UK system, then FRCOPHTH London would be the best suit for you. MRCS, well, in the past, first part, second part, used to offer you an MRCS. After that, Glasgow offered the MRCS after second part. Would Royal College of Surgeons of Edinburgh offer MRCS again after the second part? We don't know. We are still waiting for any updates. So what are the exemptions? As we speak for now, the only exemption is the advanced 180 questions. It can exempt you from the written exam. I think the advanced 180 questions have been only offered for maybe for 2 nights. So it is not a quite popular exam, so you will not find a lot of people who have already done this exam. Okay, so now let's go to the FRCOPHTH London. What are the specs of the FRCOPHTH London? The pathway can be the longest. So despite other exams, other qualifications can be only 3 stations, now we have 4 stations. Starting by part 1, a basic sciences test with no experience required. Then the refraction certificate, which can be taken anytime before part 2 oral. Again, back in the days, 4 years ago, it has to be following this sequence. Like you need to pass part 1 in order to be eligible for refraction certificate. I think in 2022 these rules have changed, and now you can take the refraction certificate at any time. You can take it before part 1, after part 1, before part 2 written, or after part 2 written, but it has to be before the part 2 oral. This is the only condition. And then you need to clear part 2 written, and the eligibility for part 2 written is that you need to pass part 1 written. And after passing the 3 exams, you become eligible to the part 2 oral exam. And then after passing the part 2 oral, you are entitled the post-nominal FRCOPHTH, or you become fellow of the Royal College of Ophthalmologists in London. Okay, so this is the pathway for exams, 4 stations. What are the logistics? Part 1 is 180 questions divided into 2 papers with 1 hour break. So it's total 4 hours. Refraction certificate, which is 10 stations in 10 minutes. Again, I think in 2022, this has changed. So it was on dummy eyes or on eye models, retinoscopy on retinoscopy models. Since 2022, October 2022, it's becoming on real patients. So the exam combination will be on real patients and on retinoscopy models, and there is also subjective refraction. So the exam has changed. Part 2 written is 180 MCQs in 4 hours as well. Then finally, part 2 oral, 5 stations, 10 minutes oral exam, 6 20 minutes practical exam stations. Actually, one of these 6 is as an oral exam, but the communication skills station, but you are examined on communication skills with the practical exam. So where do you do this exam? The written parts, like part 1 and part 2 written, are done online. The practical parts, the refraction and the orals, are done face-to-face in the UK, Pakistan, India, Egypt, and UAE, and others. So the next dates you can check, there is a huge timetable in the Royal College website called the examination calendar. You can check the next date. And the fees can be variable. For the written exams, £725. Refraction and oral exams are variable depending on where you sit the exam. Usually the UK test centers are cheaper than the international test centers. So if you did your exams in the UK, I would believe also the range of the whole journey can cost around £3,000, which is quite similar to the FRCS Glasgow. So what is the pros and cons of the FRC of London? It is the strongest UK exam route, and by strongest it means that it opens all the doors. So any door that can be opened by a UK fellowship exam, it will be opened by the FRC of London. For example, if you want to get GMC registration to apply for jobs, apply for fellowships in the UK, you can get that with the FRC of London. If you want to apply for training in the UK, you will need FRCOPHTH. If you wanted to become a substantive consultant in the UK through Caesar pathway or portfolio pathway, the FRCOPHTH is one of the prerequisites, or it can tick some, or not some, many boxes required for your application for the Caesar and portfolio pathway. Highest credibility in the UK, so most UK doctors do the FRC of London. It is usually they know little or nothing about FRCS Edinburgh or FRCS Glasgow. Also, another advantage is that it does not require experience, as it does not mean that you can pass it without experience, but it does not require experience as an eligibility criteria. So, for example, like if you are a fresh graduate and you have the necessary knowledge and the skills, you can clear all the steps even in 1 year. Part 1 and Part 2 are online, so you can do it at the comfort of your home. So here is the paradox. I can tell you something contradictory, like it is the fastest but the longest. What does this mean? It is the longest means that it is the exam that requires 4 stations. So you need to pass through 4 steps, 4 stations, 4 exams. But it is the fastest. It means that if you are good enough, if you are dedicated, you can clear it as faster than other pathways. So to give you an example, that when I started my fellowship at Moorfields in 2022, I like a month later, I applied for the Part 1 FRC of London, like the basic sciences. And surprisingly to my colleagues and my supervisors, I didn't apply for any study leaves or any, I used it to work till the last day before the exam. I have informed only few people that I'm going to do an exam tomorrow. And then after doing the exam, and once the results showed up and I passed, then they told me, how did you do that? Like we thought that you are still like naive, you didn't know how the exam is structured, quite difficult exam, and how did you pass the exam? And then a month later, I passed the refraction certificate and Part 2 written exam, also without any study. And then they become like crazy. Like I remember my supervisor at Moorfields, she told me like, how did you do that? I have never seen someone like that before. So of course this is from the teaching, but the bottom line is, or the moral of the story, like I passed 3 parts in 2 months. So if I can do that, anyone can do that. So you can still, it is not like you're going to wait for a long time for passing part after part. It can give you the if you are keen to clear these exams, it can be the fastest route. And here's an advantage that also showed up, like becoming available like 3 or 4 years ago, which is the FRCOPHTH certificate. Like after passing Part 1 and Part 2 written exams, you get a title called FRCOPHTH. FRCOPHTH, which is equivalent to membership in Glasgow and Edinburgh. So you can get this exam after only the written parts. So you don't need even the refraction. After passing part 1, part 2, which is purely theoretical, you can do them in your first year in training, and you can get a title in your first year of residency. So I don't think that any other qualification can offer you that. Of course, it goes without saying that it is the most challenging and most demanding pathway. So it is in terms of difficulty, it can be the more difficult. We can argue about that. So if you argue about what kind of difficulty you would expect from an exam, like I would call internal medicine part of or general physiology and general biochemistry and general anatomy, heart anatomy in FRCS Part 1 Glasgow more difficult than being examined on ocular investigations, for example, in Part 1 FRCOPHTH. But this is different from one to another. But no one can argue that it is quite extensive exam. It requires extensive amount of study and some sort of skills and some sort of experience. There are questions that you will answer by experience, as in Part 1 this is the only exam that can give you some clinical investigations, photographs, and ask you to comment on them, as they would expect someone like you, like in the UK training system. They will do this exam in their first 2 years of training. They would expect that you have some clinical exposure, even though that they are not formally requesting it. The second thing is refraction requires skills. Of course, you need to practice on the refraction. So this is the only exam so far that tests refraction. As I said, back in the days, more than 10 years ago, I did my MRCS Edinburgh exam, and I did the refraction test. So it was like on retinoscopy, on cross-cylinder, and I can share you a secret that the refraction test of the 9 stations of the FRCS Edinburgh, of the MRCS Edinburgh, this was the only exam that I didn't manage to pass from the first time. All other exams, whether it is ICO, MRCS Edinburgh, FRCS Ophthalmology, Glasgow, FRC of London, I managed to pass from the first time, except this refraction test. So I can't forget it. Good news is that it is no longer offered, but now the refraction is asked and requested in FRC of London. So you need to be aware of this. Also, the other disadvantage is that there is no other exam that can exempt you from any part of FRC of London. So if you did like Glasgow, if you did Edinburgh, and you wanted to shift to FRC of London, you will still have to repeat the exams all over again. Also, NHS experience, it is an advantage. If you have worked in the UK and you understand the UK culture, the NHS environment, then it can give you some advantage that you will answer some questions in the final oral exam by experience. But of course, anything can be studied. Me and others are already transferring the knowledge, and we are orienting our colleagues about what are the things that can be familiar in the UK culture, but not in our or in home country's culture. So we transfer this knowledge, so it is not a big issue anymore. If you are in the training system in the UK, you don't need me to tell you that, but you already know that there is a certain time limit to do every part of the FRC of the exams within your training. So you know already that you will still need to clear each part within certain duration. All right. Here is a good part about exemptions. If you started the FRC of London, it can exempt you from other exams. So it can exempt you from FRCS Glasgow Part 1. So let's say, for example, you did FRC of Part 1 London. You did the refraction certificate. You struggled with it. You no longer want to continue the FRC of London. You can shift to FRCS to Glasgow, but not the other way around. the full FRCOPHTH London can satisfy the prerequisite for European Board of Ophthalmology subspecialty exams. We will come to this in next slide. So in order to apply for subspecialty exams in certified by the board, the European Board of Ophthalmology, you need to clear the European Board or equivalent, and the equivalent here can be the FRCOPHTH. Okay, is it clear? So this is, in a nutshell, what you need to know about the FRCOPHTH London. And finally, the last exam will be the European Board of Ophthalmology. I think my colleagues here from Europe would be quite familiar with it. So the pathway is quite short. First of all, you need to check your eligibility, as this is the crucial part here. It is not like an exam open to ophthalmologists worldwide, as with the Royal College exams. It is only open to ophthalmologists in Europe, and every country has a certain eligibility criteria. So you need, for example, head of department approval and other eligibility criteria. So you would need to check with the website what is the requirements based on your country. Once you are eligible, it is just one exam. And this exam, you get examined in everything. So you do MCQ exams, single best answer exams, and the clinical viva, which means that it is just the clinical stations, but in form of oral discussion. Once you clear these exams, you get the title FEBO, or Fellow of European Board of Ophthalmology, which you will be then required to apply for subspecialty exams. You remember subspecialty exams similar to the ICO and the FIOF. There is also subspecialty exams for the European Board, which usually require 1 to 2 years experience. Again, there are different requirements per exam, so you need to check which exam you want and what is the certain requirements for this exam. So what is the format of this exam? It is a written exam, 60 questions in 2 hours. It used to be a negative marking in this exam, but this is no longer the case. And the viva clinical cases, so you in 4 stations, can be either on site 60 minutes or online in 80 minutes, and you will be asked on different sorts of clinical cases and how would you manage these cases. So it is not as extensive and as demanding as the Royal College exams. It's quite easy exam. Like for all my candidates who did the European Board exams, they all tell me the same thing, that Royal College exams are much harder. So they can be done online, on person, depending on the diet. There are several diets throughout the years in summer and autumn, and some of them can be online, some of them can be in the autumn. So you need to check in the website, and the fees is 600 euros. So what is the pros and cons? The pros, the advantages: it is a recognized European diploma for eligible candidates. It is the exit exam, like FRCOPHTH, it is the exit exam for UK trainees, UK candidates. Then the EBO is the equivalent to in Europe. This is the exit exam for European candidates, for European trainees. And there is availability of person and online diets. Some people get like really stressed with in-person discussion, so they can provide you some online diets. And it is a gateway to FEBO's subspecialty. So if you want to be recognized in certain subspecialty, then this will be you need to clear this FEBO first if you are in Europe, then do the subspecialty exam. Of course, that the challenges is that the eligibility is not universal, so it is not open to all ophthalmologists throughout the world. And comparing to ICO subspecialty exams or the FIOF subspecialty exams, the EBO subspecialty exams can be more demanding. Like they can require lookbook, they can require, for example, a record of your cases, like for cataract surgery. They can require fellowship training. So it is not like just you are passed an exam and you become an eligible. No, you will still need to fulfill other eligibility criteria. And the online exam requires reliable tech, as if you are doing an MCQ exam, it should be fine. But if you are doing a face-to-face exam and then the internet connection is interrupted or it is not reliable, then there will be lag, there will be delay, you will be cut off, and then it can waste you a lot of time and nerves. So it can be quite stressful. So you need to think about that if you are going to do this exam. I personally would prefer a face-to-face oral exam rather than online exam. All right, so what is the exemption? Well, FEBO will unlock the eligibility to the EBO subspecialty, as we said. And if you are, this is the good news, is if you don't live in Europe, then, and you want to do the FEBOs, you want to do the FEBO subspecialty exams, you can clear the FRCOPHTH first, and then do the subspecialty exam. But again, you need to check in the website, as every exam has different requirements. So these are the 6 exams, and to conclude, in a nutshell, a quick comparison. As you can understand that every exam has its own philosophies. I really love the word philosophy, because it is a spirit of every exam. Every exam is fit for someone. It is not like one exam fit for everyone. So ICO is a fit for someone usually who is early in their training, who, especially in developing countries, who want ICO fellowships, who want ICO subspecialty exams, but they need quite extensive reading. The exams can become more challenging, but slightly easier nowadays. They still need advanced ICO, still need the local face-to-face exam for the title, and there is no practical component, so they cannot practice usually with the ICO. Fellowship of International Ophthalmology Foundation, modern exams, slightly easier than ICO, no advanced exams. There is global access, even it can be offered in different languages if you have some language barrier. And also can offer fellowship training through scholarships if you are a young ophthalmologist from a developing country. Still, it is something developing. It is something not well recognized all over the world. No practical component. So still, the future is ahead of this qualification. FRCS Glasgow requires experience, so best suitable for experienced ophthalmologists wanted to gain access to the UK as initial step, or for example, they want to do some fellowship training in the UK and they come back. They require experience, require clinical judgment, and the critical part would be the general and emergency medicine. FRCS Edinburgh, also suitable for experienced ophthalmologists, currently written component only with the structured oral exam. The challenge is that the exam is changing, and the only remaining date will be next October. FRCOPHTH London will be the best for those who are in the UK or want to settle in the UK through either training or portfolio pathway, Caesar. And it is the longest, but as I told you, longest but the fastest if you are dedicated. Refraction, of course, require and as well as a clinical require higher standard of clinical judgment. EBO exams is the best for European residents and those seeking FEBO recognition, and eligibility is linked to Europe and is country dependent. Okay. So this is a quick comparison. If we want to put this into a navigator playbook, like if we want to now, after all the information we learned today, and we want to map all the information into a certain pathway for certain categories of ophthalmologists. So I would say pathway 1, UK. If you want to settle in the UK, if your UK is your ultimate destination, it is not like you are going to have some training and go back to your country. If you wanted to become a permanent consultant in the UK, either through training or through portfolio pathway, and Caesar pathway, which is going to disappear quite in few days, then it will be FRCOPHTH. There is no question about that. It's a no-brainer. Save yourself save your time, save your effort, save your money. FRCOPHTH is the best fit for you. Yes, it can be challenging, it can be quite difficult, but you don't want to regret. You don't want to come to the UK and then change, and then after changing circumstances, or you changed your mind, you want to settle in the UK, and then thinking, I want to start the FRCOPHTH all over again, because it's quite tough decision. And also FRCOPHTH can give you advantage with Glasgow, as I'm going to show you now. Pathway B, if you are a resident in Europe, if you actually you don't have any other options, you need to do the EBO exams. So after that, you might think, okay, you might become on the specialist register in the UK with the European rights, and then apply for substantive consultant jobs in the UK. So actually it can...
I'm sorry, don't hear very well.
Dr. Ahmed?
Yes? Sorry, is there an issue?
Hello?
Yes, can you hear me? All right, okay. So I was just talking about the if you are already based in Europe, then you can do the European Board of Ophthalmology. I think these kind of pathways are not confusing. If you are in London, do FRCOPHTH, or if you are in the UK, do the FRCOPHTH. If you are in Europe, do the European Board. Actually, the problem is if you are based internationally. Like if you are internationally, this is when it can be quite confusing, and this is when you start to wonder what will be my best option. I'm going to give you my recommendation. It's up to you if you want to follow it, or if you think you have other options. As I said, it is not one size fits all. Everyone is different, so you can tailor what we've mentioned based on your own circumstances. But if you are based internationally and you want something that will give you both recognition as well as the flexibility of moving around, of going to other country, of translocation, so you want like one solution for all. It is just I'm doing one exam once and for all. So my recommendation, I would go for FRCOPHTH from the start. As I said, it will unlock all gates, it will unlock all doors. So you can just do it as one exam and then forget, like it will be the last exam of your life maybe, and then not thinking of doing other exams later on. But as I said, if worse things come to the worst, like if you did the first part of the FRCOPHTH and you're stuck, for some reasons you cannot carry on FRCOPHTH, then the second pathway would be to go from FRCOPHTH part 1, then FRCS Glasgow part 2, then FRCS Glasgow part 3. So let's say, for example, that you did part 1, then you started doing the refraction certificate, and it is not for you, it's not gonna work. You tried it multiple times, once, twice, 3 times, 4 times, still not working. Then you want to shift your career, or not shifting your career, shifting the exam. So starting another exam. So FRCOPHTH part 1 can give you this flexibility, doing part 2 and part 3. The third option is FRCS Edinburgh from the start. Like if you have not started anything yet, then, and if the first 2 pathways are not for you, then you can start FRCS Edinburgh from the start, from next year. As I said, we still don't know any information, so I can't give any advices further than that. If this is not going to work for you, if you don't want this uncertainty of the FRCS Edinburgh, then the fourth option, or the fourth preference, would be to do the ICO standard exams, like ICO Visual Sciences, Optics, Clinical, and then doing FRCS 3 exam. And finally, my least recommendation if you want to start an exam is to start the FRCS Glasgow from the start. As I said, given the fact that the exams of FRCS Glasgow have been quite difficult over the last few years, I would put it the bottom of my choices. Like, I wouldn't start with FRCS Part 1 whatsoever. I would start with FRCOPHTH or FRCS Edinburgh next year, or ICO, and then lastly the FRCS Glasgow. Okay. The fourth pathway, let's say for example that you are in a developing country, you want to gain more expertise in certain subspecialties, then the options for you would be the FICO or FIOF. Obviously, these would be the exams that are mainly made for young ophthalmologists in developing countries to gain further training. The fifth pathway, if you want general recognition, like you don't wish to practice in the UK or any other country, you want to stay local, stay at home, stay in your country, but you just want more qualifications for your branding, for your CV, for developing of more clinical knowledge, more like to refresh your information, refresh your knowledge, be up to date with the knowledge in ophthalmology, then my first choice would be MRCS, like Glasgow, but be aware that you will need to do you can't get MRCS Glasgow with ICO exams. So at least, so you will need to do Part 1 and Part 2 of MRCS Glasgow, or you can do the CERT ROF Certificate of the Royal College of Ophthalmologists of London. So you do only the Part 1 and Part 2 and you get certificate from the Royal College of Ophthalmologists, or FICO or FIOF. So these exams do not give you a license to practice, but they can be quite good in the CV. This is if this is all what you want. The last pathway would be a subspecialty recognition. Like if you want to be recognized as an expert in certain subspecialty, or you want to gain more experience in this subspecialty, studying it more, and then being examined, and then getting a pass, and then add this title to yourself, to your credentials, then it would be the best would be the European board subspecialty exams, but you would need to be qualified in Europe or having passed the FRCOPHTH. If not, then other options would be the Fellowship of ICO or Fellowship of International Ophthalmology Foundation. So this is in a one slide. How would you think? So this is which pathway to choose. If I want to go through this pathway, how I make my decision. So I hope that this helped you to make up your mind and decide now based on clarity rather than confusion. After you making up your decision, there is still many questions to answer, not for today, but later on, like how to choose exam, which we touched on today, like if I'm doing basic sciences, which one to choose, what is the difference in the curriculum between the ICO, FRCS Glasgow, FRC of London. So there can be more details here, how to apply for these exams, what are the recommended study sources. For example, sometimes different exams can have different recommended study resources, and what is the best study strategies. Should I study text first? Should I study MCQ first? These are many questions beyond today. I hope that I can answer everything today, but this is a long process. So I think this will be the end of today, but just to give you an overview of our academy and how can we help you to go through these exams. So iCourse Academy has been established in 2024 and helped more than 10,000 candidates all over the 100 countries all over the world to achieve success in their exams. Some of you are already with us and I can recognize many names of you. And thank you for being very loyal to iCourses throughout all these years, for many years now. we take pride in our success rate 90%, but most importantly in our satisfaction rate, which is always 100%. So how can we help you to pass these exams? There is a huge library of free resources online in the YouTube, orientation sessions, scientific sessions, and we are starting a free continuous medical education program. So follow us on the social media, on LinkedIn. You will find the announcements. So we have started already the cornea. I have given like a lecture almost 2 weeks ago, and there will be more subspecialty lectures coming on the way. Also, for more serious preparation, there is exam preparation courses. There is also some of them are already available, some of them are coming soon, like investigations and refraction certificate. Also, there is our own question bank. It's not a copy from anywhere. For basic sciences, optics, and the clinical ophthalmology. Clinical cases is coming soon as well. Our own study notes for basic sciences and optics, clinical and the ophthalmology, and the clinical cases are coming soon. And there is a subspecialty courses if your aim is to gain more experience in subspecialties. So we are covering all subspecialties. Quickly, I will go through the courses we offer. Cornea, of course, I will do it quite soon. So free resources, please go through the YouTube channel. You will find a lot of scientific lectures and orientations have been done almost like more than 7 years ago. You can find quite wealth of information to orient you about the different exams and study strategies. If you plan to start seriously starting to study one of these exams, you would think of basic sciences and optics, covering anatomy, embryology, physiology, pharmacology, microbiology, genetics, pathology, immunology, optics, and instruments through our website, icourses.org. Then going through the next step through clinical ophthalmology course for covering neuro-ophthalmology, pediatric ophthalmology, strabismus, conjunctiva, cornea, sclera, lens, eyelid, lacrimal system and orbit, glaucoma, uveitis, retinal pathology, intraocular tumors, as well as other bits and pieces of exams, some parts that are required in certain exams like public health, like general medicine related to ophthalmology, like low vision aids asked in ICO exams. And then when you progress to the next stage, you will now need to clear the VIVA and OSCE exam. So we have already dedicated clinical examination course that discuss the examination techniques as they are required by different exams for pupil, for confrontation test, nystagmus, screening, nerve examination, cover and cover, motility exam, slit lamp exam, ptosis exam, proptosis, inoculated socket, entropion, ectropion, fundus exam using a slit lamp or direct and indirect ophthalmoscopy. Then you need to be ready for the cases discussion. So we have already our clinical cases discussion course, which is like quite 100 hours course, mainly video based and also picture based. So to practice, to prepare you on how to describe the science and develop a management plan in neuro-ophthalmology, strabismus, cornea, lens and cataract, covering the complications of cataract surgery, glaucoma, uveitis, posterior segment, oculoplastics, as well as emergency medicine asked in FRCS Glasgow. Other courses include that will help you prepare for your exams, the clinical trials and the studies course, covering the landmark clinical trials in neuro-ophthalmology, pediatric ophthalmology, cornea, intraocular tumors, glaucoma, and retina. Also, epidemiology, biostatistics, health economic course, covering evidence-based medicine, epidemiology, biostatistics, and health economic, which is crucial for FRCOPHTH Part 1 in London. This is a spoiler alert about a new coming course of the ophthalmic investigations course, which we have been working on for the last year, covering all ophthalmic investigations. So the course has been, I have already prepared the course. It is going to be published quite soon. I would say maybe within the next month, covering all ophthalmic investigations, quite very useful for all exams, whether covering the basic principles and also the clinical examples of the major examples of every investigation. Our newly developed question bank, as I said, it is our questions bank. It's not a copy from anywhere else. So it's called OphthoPass. You can access ophthopass.org, which would like parallel to like world class ophthalmology questions banks, showing exam mode, study mode, and it is the advantage of this questions bank that it is the only question bank that promotes the micro learning. Like it will. You can now practice on each lesson rather than each topic or each chapter. So once you study a lesson, then you can take exam, or you can study this lesson or practice questions on this lesson. So there is the exam mode, which will be timed mode. You have a certain timing and you can bookmark questions, and there is a study mode as well, which can show you the answer after each question. And there is a performance analytics, which you can track your performance across different subjects. Also, we provide subspecialty courses for master classes in different subspecialties. All the instructors are world-class instructors, Western trained and highly recognized for their achievements and their clinical expertise. In all subspecialties, all are available already. Oculoplastics is currently running if you want to join, and cornea is coming soon. And that's it. Thank you very much for your attention. I'm happy to receive any questions. So maybe Hashim, you can.
Thank you so much, Dr. Ahmed, for your comprehensive talk and your great efforts and giving us your time. There is actually a few questions from the audience.
Yeah.
First question about what exemptions give MRCS Glasgow.
So if you have MRCS Glasgow, at the moment it does not give you exemptions from any other exam. So it does not give you exemption from ICO exams. So you can't, for example, do MRCS doing advanced ICO. It doesn't work. It does not give you exemption from any part of FRCOPHTH London, and it does not give you exemptions, of course, from Edinburgh. We still are waiting for the new updates by Edinburgh next year, if it is going to exempt from Part 1 and Part 2 New Edinburgh or not, given the fact that both of them becoming theoretical now. We still don't know, but hopefully it can exempt from Part 2 Edinburgh.
One question about the meeting will be recorded. Yes, it's recorded and will be posted on YouTube channel. One question from Salma: is Edinburgh more valued and prestigious than Glasgow?
Theoretically, yes. Theoretically, but practically, it is not a big difference, either in the UK or outside the UK. Some countries can consider Edinburgh more difficult and more prestigious. So, for example, in Egypt, they have this mindset. But practically wise, can you become eligible for a job with Edinburgh that you cannot be eligible for with Glasgow? No. For at the end of the day, it is just an FRCS. So it is not like a big difference that would make you choose one over the other. Okay.
Another question: is OET a must for GMC registration, even if my high school was?
I am not in a position to answer this question, but in the GMC website, it can tell you what are the exempting qualifications from the English requirements. So go through it. I think it is just a thought that you will still need OET, as long as you didn't your school or your college was not in the West, not in English speaking country. I think you're still required, but double check with GMC.
Okay. Another question: from your experience, would you recommend which exam to start with? I have 10 years of experience, no surgical experience.
As I think this question have been asked early in the lecture, because as I said at the end of the lecture, it depends on what you want. Do you want a general recognition? Do you want a subspecialty recognition? Do you want to translocate? So depending on what you want, and we have covered this already.
Another question: can I do IOF through the ICO?
You can do the first part of the ICO. If you have the first part of the ICO, the visual sciences and optics, you can do the clinical part of FIOF directly.
Last question from Mohammed. Do you know the FEBO? Is it recognized in Gulf countries or not? Do you know that other countries, what other countries
I think they
recognize
are
FEBO?
recognized in the countries in the Gulf countries, but with the training. So they can consider you as a consultant with FEBO, but they know that if you have the FEBO that you have already trained in the West, you have trained in Europe, so they take it as a package. So they can recognize it, but with training. And it is unlikely that you would be eligible to do the FEBO without training in Europe anyway.
Okay, I think Dr. Ahmed, we answered all the questions.
I'm sorry, can I ask one more question?
Yeah.
I'm not sure if I understand correctly, but I mean the exam with the with the title with London. In practice, if you pass all these 4 parts, does it mean that you can apply from GMC, some fellowship in UK, and so on, if you already passed that?
Yes, if you pass all parts of FRC of London or FRCS Glasgow or Edinburgh, and after you satisfy the English requirements by the GMC through either IELTS or OET, you can register with the GMC, which will enable you to apply directly to the jobs, whether these jobs are fellowships or any kind of jobs except the permanent consultant job.
Okay, and when it comes to fellowship in UK, what exactly of experience do you need to do some, for example, surgery training?
Okay, this is a totally different story.
Okay.
But just to let me answer you in a nutshell.
Yeah, exactly.
So it depends on many factors. First of all, what specialty you are applying for. Like, for example, VR, cornea can be quite competitive than other specialties. You wouldn't expect a uveitis fellowship would be as competitive as cornea and the VR. The second factor is you as a candidate, what kind of experience you have. They would expect you, or ideally speaking, without going too much details, they would expect you that you have quite good experience, but not excellent experience, not an amazing experience. As if you have an amazing experience, then you would be qualified as a consultant rather than a fellow. So, and also they would require you to have some basic limit or basic foundation of your skills and knowledge. So if we say that if we give like a number of the amount of clinical skills and knowledge in a subspecialty from 1 to 10, 1 is the least, 10 is the maximum, they would expect you to be between around 7. So you have some knowledge gaps that you want to fulfill by this fellowship, and you need to be aware about your knowledge gaps. And also you should have the basic requirements. So for example, in cornea, it is not acceptable to apply for cornea fellowship without knowing the base, which is a cataract surgery. So cataract surgery, it means that you have the basic surgical level, and then they are going to teach you keratoplasty. They wouldn't expect you to be excellent in keratoplasty, but even if you are excellent in keratoplasty, you are be considered overqualified, and maybe you get rejected. So you have to know what is the minimum requirements of every subspecialty, and what is the top requirements of the subspecialty, which would qualify you for consultant practice, and you need to be somewhere in between.
I see. Okay, thank you.
No worries.
Assalamu alaikum, Dr. Ahmed.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Nice to hear you after a long time, your voice. Really. Dr. Muhammad Aslam is here.
Hello, Muhammad Islam is one of our candidates for many years now. Good to hear your voice as well.
How are you?
Alhamdulillah.
Actually, regarding the FIBO, I asked this question that which recognized in the Gulf countries or not. As you answered that until unless there is any training in that area, so after that they will be recognized. But likewise, the FRCS also, either you have passed FRCS either Glasgow, Edinburgh, or London. If you don't have any training in the UK, so they will also not recognize in the Gulf countries also. The same likewise is on the FEBO, I think. So because they are not accepting even if you are passed.
I
if you
know,
have training
I totally understand your situation, and this situation is not only you, but many ophthalmologists as well stuck in the same position, that you are stuck in the middle grade in the Gulf, and you want to progress, you want to promote yourself, and in order to get to the next tier of qualification, you need either to do it in your home country, and then you have to leave the Gulf, or trying to do it in the UK. Unfortunately, as we speak for now, there is no way, as for my understanding, that you can progress from the middle grade to consultant level with your practice in the Gulf. And even with the FRCS, even with the FRCOPHTH, you will be still in the middle grade. To progress to the next level, you need either to have formal training in the UK or any other country in Western country, and then get qualification from this country, or go back to your home country where you can proceed to the next level qualification that you can make you consultant in your home country, and the most probably your qualification will be recognized in the Gulf as well. But I understand where are you coming from. Being in the Gulf, unfortunately, can put you in a disadvantaged position. But as we speak now, there is no workaround around this dilemma.
I agree with you. So we are stuck now that where should go. Either we have to go back to the UK again for get any training. After that, we have to return back for either our countries or Gulf countries.
Yeah. All the best.
Thank you, Dr. Ahmed.
Thank you.
Jazakallah.
All right, that's it.
Okay, thank you so much, Dr. Ahmed, again for your efforts, for your time, for your support, and thank you all.
Thank you, Hashim, for inviting me. I wish you all the best. Please keep in touch. You have our website, our email, our WhatsApp. Get in touch if you have any concerns. We're always happy to help.
Thank you all. Thank you all.